Hey, my name is Dr. Eric Sterne. I work with Louisiana Pain Specialists. I wanted to tell you about one of our patients that we've been treating. This is Ms. King. She presented to us with some interesting symptoms related to long COVID, including some abnormal taste and smell. And we've been treating her, and she's been doing really well, and wanted to talk about her experience. Can you tell us a little bit about what brought you here?
I had COVID January 2021,
Okay.
and I lost my taste and smell. And I tried all the smelling and doing the 4 different scents and doing it in the morning, the afternoon, the evening, and I just never got any smell back, and I had absolutely no taste.
So really limited relief with some of the treatments and kind of. I remember.
I also did a steroid treatment that was a heavy treatment that didn't do anything.
Yeah, and I remember you saying you were pretty frustrated that just these symptoms were lasting a really long time.
Right.
We discussed a treatment, which is an injection done called a Stellate Ganglion Block, and we performed that about a week or so ago.
Right.
And since that time, tell us about what's been going on.
The minute I woke up in the recovery room, they offered me some apple juice, and I was still kind of out of it, and I don't even like apple juice, which I didn't think about when I said sure. And I took a sip of the apple juice, and I was like, ugh, apple juice, and I realized, oh, I could taste this.
That's amazing.
So it was, yes. So then I asked them, y'all have to get me something else. I need to try something else. I said, I want to close my eyes. And they came and they gave me something, and I was like, immediately, chocolate. And then I was like, oh, peanut butter. So from that point, it was just instant.
That's awesome. That's unbelievable. So tell us, so let me tell you a little bit about the procedure. The Stellate Ganglion Block is a very safe injection done to put numbing medicine next to a collection of nerves in the front of the neck. How was the procedure? Was it uncomfortable?
No, I was nervous only because, you're talking about nerves and the brain and such. And I looked up the procedure because it's used for so many other things. And so it's a very common procedure, obviously, from what I was reading. And in the room, there was several other people having the procedure. I went in, I didn't even realize that I had been sedated, and I woke up in the recovery room and had absolutely no pain, no recollection that it happened. I did have the normal, what has been identified as a flushing in my arm. I had a slight flushing in my face. My sinuses on one side were a little blocked, and that lasted, as I said, like 4 to 6 hours, and then that was it, and I have had no issues since.
That's great. So with a little light sedation, the Stellate Ganglion Block was really well tolerated.
And it was
even
like,
more
what,
important,
10 minutes? I think I live in Slidell, and I was supposed to be here for 7:30, and I was home by 9:30.
Amazing. Yeah, and even better, you've done great since that time. We're going to continue to follow you, make sure these symptoms are well maintained, that you continue to, and we want to know more about, where you're going out to dinner now.
Everywhere.
Everywhere.
I'm going to retaste everything.
All right, great. Well, I'm glad that you've had a good experience with us.